are going to go over some gastrointestinal problems. The first is dumping syndrome. Dumping syndrome is the rapid emptying of food contents into the small intestines. Dumping syndrome is a potential complication of bariatric surgery. Symptoms are vertigo, tachycardia, syncope, and sweating, which can recur within 30 minutes of eating. Nursing interventions are to eat small, frequent meals, avoid liquids for 1 hour before and 1 hour after meals, to lie down for an hour after eating. We also want you to avoid consuming food that will exacerbate the dumping syndrome, things such as milk and sugars. So we have a question now. A client who had a gastric resection 1 month ago occasionally reports dizziness, sweating, and fluttering in the chest after meals. What should the nurse advise the client to do? Select all that apply. So this is a select all that apply question. It's going to be more than one right answer. I want you to hold up your cards. So 1, avoid consuming milk, sweets, and sugars. 2, reduce the amount of protein and fat. 3, eat small, frequent meals during the day. 4, avoid liquids 1 hour before or after meals. And 5, sit up for at least 1 hour after each meal. So the right answers are going to be 1, 3, and 4. 1, because of course milk, sweets, and sugars exacerbate dumping syndrome. 2 is not right because protein and fat do not exacerbate dumping syndrome at all. And if anything, we want them to maintain their protein and fat or even go up on their protein and fat. 3 is correct because we want the patient to eat small, frequent meals during the day. 4 is correct because we want patients to avoid liquid 1 hour before and 1 hour after meals so that the food doesn't become liquefied and move into the small intestines more quickly. Or to sit up for at least 1 hour after each meal. This is incorrect because we want the patient to recline or lay down for an hour after each meal so that gravity takes a longer amount of time to pull the food into the small intestines. Enteral nutrition. Here we give feedings via a nasogastric tube, a jejunal tube, or gastric tube such as a PEG. Tube feedings are usually started full strength at a slow rate. The healthcare practitioner increases the hourly rate every 8 to 12 hours until they reach the desired rate. The head of the bed has to be at 30 degrees or higher to minimize the risk of aspiration. Signs of intolerance with the tube feedings are cramping, nausea, vomiting, diarrhea, and high gastric residuals. Residual amounts can range from 100 to 250 mLs Q4 hours depending on the diet. Of course, if we have a patient where their residuals are 100 mLs or higher, we do not want to refeed the tube feedings to them. We want to hold those residuals. These patients need excellent, strict INOs as well as daily weights, and we want to give them meticulous mouth care because they're MPO. X-ray is no longer the most reliable method for checking gastric tube placement. Now we actually do gastric pH to check for gastric tube placement. So here we have another question. An older adult client is scheduled for intermittent tube feedings by a syringe, so they're not going to be getting the tube feedings every minute from a feeding pump. To ensure client safety during the administration of the feeding, the nurse should take which of the following actions? So let's take a look at the answers. Unclamp the feeding tube and then connect the syringe to it. Heat the formula before administering the feeding. Verify there is no more than 300 mLs residual prior to the feeding, or pour the formula into the syringe, raising or lowering it as needed. So everybody hold up your cards. Great, I see a lot of right answers. But the right answer here is 4, to pour the formula into the syringe, raising or lowering it as needed. Here, gravity will take over for you. We're not going to use the plunger in the syringe. We're just going to fill it with tube feeding. If we raise the syringe, the gravity will take it and the tube feeding will go faster. If we lower the syringe, the tube feeding will go more slowly. We want to give the tube feedings over a 5 to 10 minute period. This way the patient does not have gastric distension, they do not have vomiting, they do not have aspiration. Number 1 is wrong because when you unclamp the feeding tube, you immediately want to fold it over and kink it. Then connect the syringe, then put in your tube feeds, then unkink it. This way it cuts down on the amount of air going to the patient's stomach. You do not want to heat the formula before administering the feeding. You want it to be at room temperature. So if the tube feedings are in the refrigerator, please take them out so they warm up to room temperature about an hour before you're to give the tube feedings. Verify there is no more than 300 mL residual prior to the feeding. If there is anything 250 or greater, you're going to hold for patient to have an assessment. 300 mL or greater is too much of a residual to have. You're going to follow your agency policy, and the patient needs to be assessed for the size of their feeding tube, the amount of tube feeding that they're getting, and also their medical conditions. So here, pour the formula into the syringe, raising or lowering it as needed is the correct answer. So here we talk about having a healthy lifestyle, nutrition, exercise, weight control, health screenings, control risk factors. Risk factors that we want to avoid are smoking, sedentary lifestyle, alcohol use, high-fat diet, high stress. Following U.S. dietary guidelines requiring fruits, vegetables, and grains. Fruits, vegetables, and grains all have excellent minerals and nutritional value. They also are bulk forming because they have fiber, so they help flush out the fat and the waste in your system. Grains are an incomplete protein. Proteins actually go a long way to helping the body tissue in growth, maintenance, and repair. Also, proteins are important for acid-base balance as well as fluid regulation and also blood clotting. Whole proteins are things like chicken, beef, cheese, turkey. Things dairy such as calcium and cheese provide a perfect amount of calcium to help muscle contractions. Isotonic exercises such as walking and swimming and jogging increase muscle contractions. They also lengthen the muscle mass. Walking, swimming, and jogging help to improve the circulatory system and the respiratory system. These exercises go a long way to improving muscle mass, muscle tone, and muscle strength. They also fight osteoporosis. Isometric exercises are the tightening and tensing of muscles when you're not really moving around a lot, not moving body parts. This is very good for the immobile patient or patients who don't get a lot of physical activity. These exercises go a long way to giving muscles tone, strength, and mass. They also help fight muscle wasting, atrophy, and they also go a long way to helping circulation. A BMI is a weight in pounds multiplied by 703 divided by height in inches, or weight in kilograms divided by height in meters squared. We need to check on things like our blood pressure, diabetes. We need to have colon rectal exams. We need to have colonoscopies over the age of 50, mammograms over the age of 40, and men need to have their prostate checked. Here's another question. A nurse performs a nutritional assessment on an active older adult client experiencing unexpected weight loss. That is the key, unexpected weight loss. Which of the following recommendations should the nurse make? So this is in the affirmative. What is the nurse going to tell the patient to do? And we're going to pick one right answer, the best answer. So 1, delay beverages until you have finished the meal. 2, focus on increasing caloric intake at breakfast and dinner. 3, eat more fiber-rich foods such as fruits and vegetables at every meal. or 4, include protein-rich foods like cheese, peanut butter. Let's see, the right answer here is answer 4, include protein-rich foods like cheese and peanut butter. Cheese, peanut butter, eggs, milk are excellent sources of protein. Many adults face situational challenges, like they have trouble getting to the food mart, they have trouble putting the items away in their pantry, housing things in their pantry, and they also have some financial challenges as well. Foods like peanut butter and cheese and eggs are easier for them to find at the store. It's easier for them to house in the pantry, and it's also cheaper than some of the more expensive proteins like steak or chicken. Older people have trouble chewing because of their teeth or their dentures, so protein-rich foods like cheese or peanut butter or eggs are much easier for them to swallow and chew. Experts say that older adults need actually more protein in their diet than they needed when they were younger. And this patient in particular had unexpected weight loss, so we want to give them things that are caloric but protein calories, good calories. Delay beverages until you have finished the meal. This is incorrect because many times adults are dehydrated. They don't have the same thirst mechanism as a younger patient. They don't make saliva the way a younger patient does. So very often when they're chewing, the food is very dry and pasty. So you actually want to encourage giving them a beverage so that they can liquefy the food and chew and swallow the food. Focus on increasing caloric intake at breakfast and dinner. This is wrong because you actually want to recommend for the patient to break up the meals into 6 small meals a day. So giving frequent small meals over the day. We don't want to increase 2 of the 3 big meals. We want to cut it down to 6 small meals a day. Also, it doesn't tell us what kind of caloric intake. We don't want older adults to have salt, sugar, simple carbohydrates, fat. We want them to have things like iron, protein, vitamin A, vitamin D, vitamin E. So that's why that is incorrect. Eat more fiber-rich foods such as fruits or vegetables at every meal. Now, this is very good because fruits and vegetables give you a large amount of nutrients in relationship to kilocalories. However, you don't need to eat fruits or vegetables at every meal. Therefore, 4, include protein-rich foods like cheese and peanut butter are the correct answer. Does anybody have any questions or any comments that I can go over? I want to thank you very much for allowing me to teach you this module today. I wish you all very well on the NCLEX, and everybody have a wonderful day.